In October this year, Lubaga Hospital will be marking 125 years of community and faith-rooted healthcare. In the years, a lot has been achieved, challenges notwithstanding.
So we've been able to provide specialized, general, preventive, and curative services to the country for 125 years. And we want to give a pledge of excellence, a pledge of quality to the population. We've been here for 125 years. We are still around for the healthcare needs of the country.
It is on this note that Dr. Julius Luimbazi, the Executive Director Lubaga Hospital, calls on government to solve the access to quality services equation through strengthening partnerships with private players in the sector.
Healthcare comes with a cost. It's not cheap. And cost is the biggest barrier to healthcare. We know Ugandans are suffering with out-of-pocket expenditure on healthcare, and that is a problem. We know the best thing is to have an insurance-based financing of healthcare, where the people have a fund where they put their money and they're able to get financing when they fall sick. We pray that the government of Uganda puts forward legislation that will be able to provide for that.
State Minister for Health in charge of general duties, Hanifa Kawooya, allays these fears by assuring Ugandans that efforts to have the National Health Insurance Bill retabled in Parliament are at the tail end.
Consultations have been going on. As a cabinet, we have looked at it. Whatever needed panel beating and some agreements and consensus have been reached. So the moment you reach consensus with all stakeholders, what is remaining is now for a legal framework. And the legal framework is by the members of parliament. Now, the members of parliament are also eagerly waiting to ensure that for the first time, we also in the East African region, we can have a national insurance scheme for our people.
Lubaga Hospital was recently accredited by the Council for Health Services Accreditation of Southern Africa, COSASA, making it the second internationally accredited hospital in Uganda after International Hospital of Kampala. This is in addition to the previous elevated status the facility underwent and acquired specialized center for organ transplant.
And we are proud of that. That is why we are celebrating today, because we want to lead in quality health care. We want to be known as a hospital that provides quality health care to the population.
Earlier, a mass led by the Archbishop Kampala Diocese, Paul Semogerere, was held in a show of thanksgiving for the milestones registered. Archbishop Semogerere sermonized on the importance of health workers to render service beyond self.
And being a medical doctor, a health worker, a nurse is a gift that comes from God. They shouldn't complain that they have no work. They are lucky that the work is always there. We shall always have sick people, and they are needed as health workers. Let them not take this for granted. God has given them this gift. Let them give this gift to the people that need it, because it comes from God.
Lubaga Hospital is the second oldest health facility in Uganda after Mengo Hospital that was established 2 years earlier. Wow. Dorcas Kimono,